Initially, we were studying a neglected tropical disease of West Africa that is called Buruli ulcer, which manifests as chronic skin lesions. This disease is caused by infection of the skin by a bacterium, mycobacterium ulcerans, that produces a diffusible toxin called mycobacterium. We first discovered that this toxin targets the secretory system of human cells and more particularly blocks the entry gate of this system, a protein channel known as the translocon. We then showed that cells that are exposed to mycobacterium undergo intoxication. Indeed, the proteins that are normally exported to the extracellular milieu are blocked in the cell, and their accumulation triggers a program of cell death by apoptosis, hence the lesions in the proximity of the bacteria. We reasoned that this blockade could be used for therapeutic purposes, to kill unwanted cells that are particularly secretory, and we thought of multiple myeloma, a cancer of the bone marrow that is due to the proliferation of plasmocytes, the lymphocytes that produce immunoglobulins. Multiple myeloma is a cancer that affects more than 5,000 new patients in France every year, making it the second most common blood cancer. Typically, it appears around the age of 70 and it will more frequently affect men. There have been major therapeutic advances over the last 20 years, but to date, this cancer remains incurable with a 10-year survival rate of around 26%. This is because although patients generally respond well to the chemotherapies, they will inevitably develop resistance to the treatment and they will eventually relapse. Using cell and animal models, we observed that translocon blockade was particularly toxic for myeloma cells, much more than for non-cancerous cells, and that there was a therapeutic window of action for our translocon inhibitors. In addition, blocking the translocon was very effective at killing myeloma cells that had become resistant to the current chemotherapies, giving us hope of being able to treat relapsed patients. I knew I had a new target with a very promising therapeutic potential, but didn't have a clue on how to proceed and exploit my discovery. It took me a long time and a lot of persistence to convince the DARI at Institut Pasteur, but once I caught their interest, they provided me with a decisive help. It was them who convinced me to give up on the idea of optimizing my bacterial toxin and embark on a totally new drug discovery program. They put me in touch with the right people on campus, and we carried out together a small molecule library screening, structural modeling, and they provided me with seed funding as well. The second key event was my encounter with the Argobio startup studio, and that was the start of an intense collaboration and an immersion into the world of biotech that was totally new to me. So with Argobio, we set up an extended project team that included not only scientists specialized in the biology of the translocon in our lab, but also specialists in small molecule screening, bioinformatics modeling, medicinal chemists, patent specialists, etc. Today we are in the process of registering a patent. This is a very symbolic event. It represents the culmination of years of effort by a number of people in my lab, substantial investment by the Institut Pasteur and Argobio, with a significant amount of risk being taken since it was only very recently that we were able to achieve our objective, the identification of new therapeutic molecules targeting the translocon. And the next step will be to create a startup. On a personal level, it was a very new experience since the translational research that we carried out around this translocon project was very different from the basic research we were used to doing. I found it less nerve-wracking in the sense that there was not the disappointment when facing a working hypothesis or a scenario that you can't validate experimentally. Here, our objectives were mainly technical, and one way or another, you end up succeeding. And then to see one of our fundamental discoveries translated into a treatment is obviously very satisfying and a tribute to the spirit of Louis Pasteur.